Perhaps I should have mentioned it from the beginning that in both these studies, we are harvesting numerous high-resolution, atomic resolution, cryo-EM structures of various patient-derived amyloids, hundreds of which have been determined in recent years, thanks to the so-called resolution revolution in cryo-EM. So thank you to all those scientists who made a heroic effort determining these structures. So essentially, we are looking again at the surfaces of amyloids, and they have linear arrays of hydrophobic residues, which we just discussed, but also some acidic residues and some basic residues. And these acidic residues are separated by 4.7, 4.8 angstroms from each other, and pairs of acidic residues are typically required in proteins for calcium binding. And you always have such pairs on the amyloid surface, although sometimes they are compensated by the adjacent residues of the opposite charge, sometimes they are not. And in some occasions, there are even several acidic residues from the same molecule sitting side by side on the amyloid surface and creating a very wide acidic area, positively charged area along the surface, which again would be terribly energetically unfavorable because they all repel each other. So one would expect calcium to be binding here. And so we kind of combined this general structure-based and biophysics-based observation with a clinical finding that in the explanted valves from calcific, explanted tissues from calcific aortic valves, very often clinicians see amyloids in immediate proximity to calcific deposits. And the nature of this amyloid is not entirely clear. Some say it is formed of APA, lipoprotein A1. Others have other ideas. But so that still remains a question mark. Perhaps it really depends upon the subset of patients that are being studied. But we thought that due to this acid, all these amyloids, regardless of the nature of the protein, are expected to have these acidic arrays on their surface. So we thought that by virtue of high affinity binding of calcium to these acidic residue pairs, these calciums might perhaps form a nucleation sites or calcification. Now, what happens during calcification is you need some substrate, which in the bone, for instance, which is also, a calcific deposit, you have a collagen fiber with some acidic protein that nucleates the formation of first amorphous calcium phosphate, which then converts into the crystalline mineral in a particular form called calcium hydroxyapatite. And we noticed that the spacing between two adjacent calciums in amorphous calcium phosphate is exactly the same as between amyloid letters, 4.7 angstrom. So we thought, okay, you have a couple of calciums bind by pairs of acidic residues on the amyloid surface. Then they can pick up some phosphates from solution and act as a nucleation center for amorphous calcium phosphate, which then later crystallizes and slightly changes its structure and converts into hydroxyapatite, which then forms calcific deposits. So our current understanding is that perhaps amyloid fibrils, which are found in the vicinity of calcific deposits, might act as nucleation centers for amorphous hydroxyapatite, whereas collagens perhaps promote further growth of the mineral phase and its crystallization. I am not going to talk at the meeting much, at least, about the role of collagens. This is still work in progress, but it appears that collagens, at least in our and other in vitro studies, are synergistic with amyloids in promoting calcification. If you just use a test tube and use saturated calcium phosphate solution to see how it crystallizes, then by adding collagen, you can speed up crystallization. But if you add amyloid, you also speed it up. But if you add both of them together, then you speed it up enormously and you get a lot more crystals and a lot faster. So clearly there is some synergistic action between the three components: calcium phosphate, amyloid, and collagen. And it appears like collagen, the type of collagen is important. The type of amyloid, perhaps less so. So we are not entirely clear about the mechanism, but again, our current thinking, and that might change as our experiments progress, is that amyloids provide nucleation centers for amorphous calcium phosphate due to the stereochemical complementarity between the acidic arrays on amyloid and the calcium-calcium spacing in calcium phosphate. And then once these complexes grow and they can aggregate together, get condensed, and then ultimately get converted into mineral, probably with the help of collagen.